Excited to talk about. There's one remarkable invention that has covered a lot of ground. It's the 3D printer, and it's changing a lot of our lives. So now we can print all kinds of things, from hamburgers and other food to guns. But 3D printers are also revolutionizing healthcare as well. Hopefully we have this picture. Do we have this picture, guys? I'm not sure if we have it, but apparently there was a duck who lost his leg in a fight, and a mechanical engineer printed a new one for him. So you saw the hamburger, you see the guns, hopefully we'll see the duck there, and look, he has his new leg because of the 3D printer. Scientists can actually print a human skull replacement as well. New researchers have printed something like this as well, these two ventricle cylinders. An important piece of the puzzle is they try to develop a way to print human hearts. Dr. Kevin Campbell is a practicing cardiologist and an assistant professor of medicine at the University of North Carolina. Can we really do this, Dr. Campbell?
I think the technology is here. As you know from the past, we've already seen a child have a windpipe 3D printed and placed in, and these children are doing well. I think we can also do it with hearts and kidneys and other organs, but I think we're probably 5 to 10 years down the line.
How does it work?
It actually works like an inkjet printer, believe it or not. Instead of ink, you infuse the printer itself with stem cells and cells that are harvested from biopsies, along with a biologic matrix. And then computer programs tell it how to print this three-dimensional organ. And it is very, very complex, very difficult to do, but it works.
Talk to us a little bit about how difficult it is to do a heart implant from somebody else. If someone needs a new heart, it's very hard to get that and hard to get a match. If we were printing our own new heart based on our own cells, would that make that type of transplant much easier, much more difficult? How about the real life application of it?
The real world application is very significant. Right now there are about 3,000 people who need heart transplants in the U.S. There's only about 2,000 organs, which means that 1,000 people a year die before they get their heart. However, if we're able to print 3D organs, we're able to offer these hearts to other people that need them. And when you get a heart transplant, very complex. You're trading one disease for another. You now need medicines to prevent rejection and to prevent infection. If you're transplanted with a printed heart from your own cells, those aren't issues anymore.
What about cost? Is this something that insurance would cover eventually?
I think that that's a long ways down the line. I think that right now it's going to be very expensive because there's a lot of research and development going into it, and that may be one of the issues we have to face as a nation is how do we pay for this sort of thing, and how can we make it accessible to everyone that needs it?
Of all the different organs, and you mentioned a few like kidneys, for example, we were talking a little bit about livers yesterday because of the school stabbing at a high school, and there was a puncture wound to a high schooler's liver, and you think, is he going to need a transplant, and how difficult that is. Of all the different organs, as far as specific to the heart, is this something that is easily done for our heart muscle? Is it more challenging because it's the heart?
I think the challenging part with the heart is that you have to have heart muscle cells that work together in conjunction to pump blood to the rest of the body, and you have to integrate it with the valves between the chambers in the heart. I think that it is very, very possible, but I think we've got years ahead of us.
In the more immediate, though, I was looking at this story of this 14-year-old boy, Roland, whose surgeons were going to do surgery on his heart because he had some malfunctions to his heart. And so what they did is they did a printing of his heart, and they practiced, if you will, the surgery on it. And it cost him like $600 to print a heart that was about his size. What about those applications on a daily basis? Is that a couple years away, or is that something that you're seeing more of in your profession?
We are seeing lots more simulations as we train young physicians to operate like I do and other physicians do. And it's so important to be able to have those practice runs. And I think a three-dimensional copy of what you're going to operate on is very, very important. In addition, we're doing research on drug trials and things like that. Wouldn't it be great to actually do that trial in a real heart that's printed from 3D tissue rather than in an animal model or something of that sort?
It does bring up some ethical questions, which we'll leave for another time. But it is very interesting. And at this point, if anyone was doing the surgeries, I guess I would start requesting, right? I want my own 3D heart before you go in there, Doc, just to make sure that everything goes okay. Practice makes perfect. Dr. Campbell, great to see you.
Thanks for having me.
Very much. Eric?
Wow, Jen, that's absolutely amazing. Well, coming up here in the final